Now I invite Dr. Suma, professor in the Department of Prosthodontics, at the Faculty of Dental Sciences, MS Ramaya University of Applied Sciences. She has been in this position since 2014. Her expertise in dentistry, particularly Prosthodontics, which focuses on restoration and replacement of teeth. Dr. Suma holds a Master of Dental Surgery degree from Bengaluru University. She has contributed to numerous publications and workshops in her field, particularly on topics like rehabilitation and implant dentistry. Now it's yours, Dr.
Very good morning to one and all present here. I, with due respect to all the chairmen, co-chairmen, all the panelists here, all my seniors like Dr. Kulkarni and other doctors here, and my students over here. I'm here, Dr. Suma, from the prestigious institution or university, MS Ramaya University. Now it is called as Ramaya University of Applied Sciences. I work for the Department of Prosthodontics as a professor. And I'm here to share my few thoughts about the applications of gene therapy in dentistry. Before I start, I was thinking if I'm a wrong person here amongst all these esteemed speakers over here because my topic is totally different. And I was caught unaware that students would be the target here. And I was prepared for a lecture or a talk, just a discussion with all doctors over here. And I had to change my entire presentation just few hours back in the morning. And I hope it conveys to you whatever I would like to convey it. Dear students, I want your attention please here. Please raise your hands as how many of you have really been to a dentist for your oral health checkup regularly or even once a year. Please raise up. I see the count very less. Please raise up. Yes, the balcony seems to be a better hands up. What about this side? Is it that you're ignorant about dental issues or you think that it's not going to hamper your systemic issues? Why is it so that you're not been to a dentist? Okay. Quickly, let me run into the few slides. My slides quality will not be great like all your other previous lectures that happened because I had to prepare in a short notice. And this is my area where I'm working, where I'm majorly working with replacement of the teeth and associated structures, basically intraoral, but we also replace ears, face, parts like nose, and many other parts of the face like your jawline, your chip, your temple areas, your forehead, whenever it is been missing because of, say, trauma or congenital or acquired for any other reasons, and most often mainly for cancerous lesions. Yes, this is what happens. Life is what happens when you're busy making other plans by John Lennon. Isn't that true? We are all busy planning for our future, and in between we come across so many other illnesses that bring us down completely down to the earth or reality of life. Yes? You all agree with me, I guess. We all know greatest wealth is health, and oral health is a mirror reflecting the health of the entire body. That's the reason I asked, how many of you are regularly visiting your dentist? Why dentist? Because we can get to know about the diagnosis or at least screen and let you know the information as what would be happening with your entire system. You may not believe it. Yes, it is true. If your oral health is good, your systemic health is also connected to oral health in many, many, many diseases. You may not see all the diseases in the mouth, but majority of the diseases are giving us some signals, some signs, some symptoms in the oral cavity. If you have a regular checkup, most of your system conditions can be treated at a very early level. That's what is my request to all of you is. Yes, these are some of our cases which we deal with, which no human being should go through such kind of condition. Let it be us, our own people, our own friends, even the worst enemy of us, of ours should never end up in a cases like this. It is very, very saddening to see such cases, especially after COVID. We have been getting every day not less than 30 to 40 cases of mucormycosis or black fungus or infections of these involving the entire mouth, not just the mouth, but entire eye, orbit area, the nose, the entire palatal area. In fact, it extends even to the brain also. Okay? The problem is when they survive. We are not looking at the death, but when they survive such cases, it's a most painful or traumatic phase of their life. They want to live, but they cannot live. They want to eat, they cannot eat. They want to smile, they want to function like you and me, they cannot. Let us pray God that no one should be a victim of such kind of situations or cases. Yes, we are there to treat, but can you imagine the pain and agony the patient will be going through because he survived these particular situations, right? So these are some of our other areas where it has been affected mostly by cancer. So I didn't want to show these kind of cases, not to traumatize you all, but then I wanted to make it more strict thinking about your oral hygiene and your oral diagnosis. That could help us in diagnosing many other systemic conditions. Yes, we not only treat teeth and associated structures or patients affected by cancer, we also make theoretical processes. I think most of you can relate to the movies which has been shown here, and the bottom pics are all our students who have been mimicked or simulated to the reality of the movies that has been already placed over there. We could bring it to close reality. That means we can also make imperfections to the perfect realities, right? So this is our area. This is my branch where we deal with the artificial replacement of the teeth and the associated structures. Not just the teeth, not just the, I think you must have heard of implants and fixing of teeth, crowns, bridges. These are your common terms which you already know. So it's just not that we do that. We also place obturators whenever there's a palatal defect. We also place mandibular processes for mandibular defects, buccal cheek areas, also your eyes, nose, and all these characters also could be done with the help of silicone or medical grade silicones materials, right? Coming to my topic, I think all of them have, sorry for the slides. I don't know which direction it's going on, sir. I think all the pioneers have already spoken about gene therapy, the types of gene therapy, therapeutic gene therapy, what we have. And I did not go in detail because I'm not going to deal with the basic science and technologies. I just want to know there is a solution to all our oral health and systemic conditions. That's the only thing I want to convey here. So my specific learnings would be based on this. Why early detection is required. We all know oral cancer is a significant health issue with high morbidity and mortality rates. Among all the cancers, I think the oral cancers, yes, the oral cancer is the one which has got high morbidity and mortality rates because it is undiagnosed. Everybody mistakes that it's an unhealed ulcer for a long, long period of time because of diabetes, because of that, because of these conditions, systemic conditions and all. But most of them, if it detected early in the stage 1, it can be treated without going to the stage 2 and stage 3, which is not easily manageable at a clinical level, right? So this early detection can be leading to effective treatment, increased survival rate, preservation of your oral function, and minimized treatment and lower healthcare costs. This is the most alarming situation what we have, dear students. Today you're all young, but by 2045 to 50, you're going to have the highest population of geriatric population where you're going to have every other patient with every kind of systemic conditions and oral health conditions. Are we all there to take care of them, or are we all there to be ready for this kind of a situation? It's a very, very alarming situation. Why? Because we have very good medical science, technology, healthcare insurances that has come up, where the lifespan of an average human being itself is extended to a larger extent, right? Earlier it was all 40, 50s we could hear from our parents or from our grandparents that we lost them, we lost them, we lost them, we lost them, we lost them. Now we have more and more human lifespan extending to a larger or greater age. More the age, more the issues. Are we all prepared to meet these demands? We are going to face this situation in a reality very soon, right? Now, oral cancer accounts for 2.1% of all cancers. Do you know this? Yes, this is also very alarming. Why? Because we have high tobacco use. I wanted to ask the students how many of you really have tasted once at least tobacco. I know you will not raise your hands, your staff are here. You will not raise your hands, but in some form you all are abusing yourself. Yes? Yes or no? No? I know. That's very, very unbelievable. Right. Any form of tobacco, alcohol consumption, any kind of HPV infections, all these are absolutely leading to your oral cancers or interlinked to oral cancers. Now, we are more worried about the rural areas because we are going to have the elderly population more so in our rural areas than our urban areas. At least we are in urban, we have little education, we have little awareness. We, one or the other day, we will meet a doctor. Yes, but in villages, it is very, very difficult to meet the rural demands because 80% believe or still are in that primitive stage of not going to meet a doctor unless it is very, very critical. Right? Yes. Now, why we have to go for, yeah, I'll come back to directly why I'm looking at the gene therapy, because the pulp, we know that there are 3 layers of structures in the pulp, in the tooth. We have the enamel, the hardest layer, the dentine and the pulp. Why pulp alone? Because it has got a lot of nerve innervations. It has got a lot of cells that can regenerate and that can be mimicked into your dentin-like structures, or you can also make a bone-like structures, right? Now, this also can be used in oral, not only in oral, but we can also use it in our systemic conditions. I'll just tell you. I'll just run through the slides quickly. These are our different conditions where these kind of genes can be replaced. We can also do orthodontic treatment with our gene therapies, or we can fasten the treatment, in fact, with our gene therapies. We can also do periodontal, which is a high risk for all kinds of systemic conditions. All systemic conditions will have oral hygiene very poor. Okay, so this can be prevented. We can also develop vaccines, and I'm more interested in dental pulp derived MSCs or mesenchymal cells, because these can be used in systemic applications in all these medical conditions like neurological disorders, cardiovascular, bone regeneration, liver diseases, muscle regeneration, immune modulation, wound healing and diabetes, and many, many other conditions. We can use these cells in various other applications, not only oral, but into all the systemic areas also. So this is my interest. So I will not go into detail. Right now we have these kind of biomarkers, which is very, very helpful for us to diagnose the oral cancers and breast cancers and many other cancers just by using saliva as a media to test. If COVID was a success, it's all because of the liquid that was freely available in all of us, right? We all produce around 600 to 1 liter of saliva that is more easily available than your blood and other types of assays. If you can if we can develop a system, a diagnostic tool where using saliva can be predicted, or we're able to diagnose many other conditions, I think most of us will be having a safer tomorrow, right? So from my side, I would like to say that you're all in this field because you're choosing this field to be in the life or biotechnology. So you students should emphasize on your oral health personally and look for your own people around yours in your houses, your neighbors, your friends, and your areas. That would take care of the system in general for tomorrow. I'll not go into these research challenges. I think it's left to our regulatories and other areas to be concerned. If they can help us out with all these regulatory items or regulatory insurance and all these issues here, I think we'll be able to meet the gene therapy itself as a treatment therapy for all our conditions. These are your research gaps and future directions. If we can use saliva as a liquid biopsy for cancer screening and early detection, I think we'll be in a more safer world tomorrow. I want to emphasize, being a oral health department or prosthodontic or dentistry department, my only concern is if technology could come where we can just using saliva as a biomarker for cancer detection, I think most of us could be saved, we can save others and our own people in general in the whole world, right? Thank you so much. I only emphasize, please get your health checkup done regularly by oral dentist, because every system has some signs of symptoms in your oral cavity. Do not take it as just a normal routine filling, implant, crown, bridges and things like this. Something that is very, very, very awakening that is required. Yes? Thank you all students. Thank you all again. Sorry for the time I've taken.
Thank you, Dr. Suma. That's a wonderful presentation. I just request all the speakers to maintain their timings because we are running away from time. And I would like to ask some quick questions from the panel, if you have some. If not, we can move on to the next speaker, Dr. There's a one question, sorry, for Dr. Suma. Let us have a quick question, one question for Dr. Suma. Sir, presentation. Sir, presentation. Just check.
Cost of the treatment with the gene therapy.
Sorry, ma'am.
Cost of the treatment with the gene therapy.
Ma'am, right now all the studies are in the preclinical stage, ma'am, that is in animal model stage, where we have yet to develop so many vaccinations regarding even the basic treatment like periodontitis, which is common amongst all. So replacing with the gene therapy would be very costing, so that is why we are all here to request for the infrastructure and the funding and the regulatory bodies to take care of these simple devices if it can be developed, okay, like a salivary biomarker or using saliva. I think that would help us in a long way from now on. So I don't say that gene therapy is already developed. We are only looking at science that is already in place or it's ongoing research.
Development of the science, the
Yes.
development, how much it has developed and how much we can adopt. So
A
practically,
lot of preclinical studies have been going on and it has given very good results and a lot of trials are also happening.
yes.
So very good results we are
is
having.
it happening at your institute?
Yes, ma'am. It is happening all over, but Ramaya also is a very, it's taking a very active role in these kind of studies for research.
Thank you. Thanks.
Thank you.
Another question is from Dr. Krish.
Madam,
Yes, sir.
that was a wonderful presentation, madam.
Thank you, sir.
My just question, maybe 20 years back, I guided a student for, we were talking about diagnostic methods.
Yes,
okay?
sir.
So what are the methods available? I'm just trying to educate myself.
Yes, sir.
What are the diagnostic methods particularly available? Apart from, you were talking about, I mentioning sialic acid, salivary sialic acid.
Yes, sir.
Apart from that, like serological biomarkers, like enzymes or proteins, do you have any genetic tests, particularly at the mutation level? Because I happen to work on a kit which one of my students developed 20 years back.
Diagnostic salivary
Yeah,
kit, sir?
No, it's a blood diagnostic
Yes,
kit.
sir. Yes.
Or any sample, you take. It was on beetle quid induced oral submucous fibrosis gene expression. So you, instead of going for a biopsy and testing it, so you, can we encourage people to develop pre-diagnostic kits so that
Yes, sir.
based on gene level expression?
Gene level is still in as I told madam, it's still in a very primitive stage of preclinical studies happening. We have going through a lot of trials as of now, but it's still not become our regular diagnostic level. It has not gone to that level, sir. So as of now, we are able to screen the saliva assay. We are going to test the saliva in wherever is possible, whatever test available with us, and we'll be able to see whether the patient is a high risk prone for any kind of cancer, especially oral cancer.
How reliable are these tests or the
So,
results that we get?
yes, I agree that. See,
See, everybody,
yes.
as you rightly, very clearly mentioned, and we had a very few audience who
Raising.
don't even care about their
Oral
hygiene
health,
or
yes,
whatever.
yes.
Even me, maybe after 30, 35 years, I realized, what we have to try to get tests, like how you check your blood sugar level or HbA1 or whatsoever it is, we should have people from, particularly from the medical community,
So
coming
this
out
should
with
be made a
diagnostic
mandatory
methods.
rule in all clinics, in all hospital, as a salivary screening test should be made available in all levels, from the basic levels, sir. Right from schools, if we can start the salivary testing. No, meet all the rural, and it should be available in all the clinics and all the hospitals. If it is made mandatory rule, like if the insurance people can cover the salivary tests, that test that is coming for your like your regular blood test. If they make in this also salivary as a basic test, mandatory test, I think very sure that we can diagnose or we can detect most of the cases in that early stage itself. Not all tests are reliable. We have double tests, we have triple tests to confirm it. Confirmatory tests are more reliable. But I think saliva being the most available liquid in our mouth, in our body, I think we should be able to
Madam, I
utilize.
think you people, like Dr. Vidya, yourself, you should take initiatives because
Yes,
you're
this is-
academicians.
Yes.
Yeah, actually, I want just to tell, we have also already worked with RV Dental College, and we have published about this,
Markers, salivary
not
markers.
markers, about your, one of the viral attack you mentioned after COVID, I think
Mucormycosis cases.
mucormycosis, that we have working with RV Dental College, and we have already published about what exactly it is. I think we are open for further collaboration with Ramaya too.
Yes.
We are doing it. We are working with our dental college students also.
I would have expected more questions from the students who are not aware about oral health and its significance. I'm sorry, I didn't see any takers there.
So, in the interest of time, let me wind up Dr. Suma's talk.